it's likely that some of the nursing advice you'll receive will be inaccurate. So here are some breastfeeding myths that have been debunked. It's normal for nursing to hurt. Pain is a warning sign that your baby isn't latching onto your breast properly, despite the fact that it's usual to feel uncomfortable at first. Instead of focusing solely on your nipple, she should expand wide and suck your nipple and breast deep into her mouth, massaging milk out of your breast with her jaw and tongue, explains Parents Advisor Jane Morton, MD, clinical professor of pediatrics at Stanford University and a breastfeeding expert in Menlo Park, California. Continually shift your baby's posture until he or she feels comfortable and secure. You'll both get it perfect with a little time and patience. You need to toughen nipples for breastfeeding. Your breasts naturally change throughout pregnancy, preparing them for lactation, says Christina Smiley, MD, a pediatrician, lactation expert, and founder of Breastfeeding Resources in Stratford, Connecticut. The area around your nipples will thicken and the glands in your areolas will generate oils for lubrication and protection even before your baby is born. A rise in the hormone oxytocin occurs once your baby is born and you begin breastfeeding, making your nipples more malleable and supple for your baby's mouth. A lactation consultant can teach you strategies to help you nurse if you have flat or inverted nipples. Breastfeeding will cause your breasts to sag. Droopy breasts are a result of hormonal changes that cause the ligaments beneath them to loosen and stretch during pregnancy. Your breasts may sag as you gain weight and they become larger and heavier, explains Matthew R. Skolman, MD, assistant professor of plastic surgery at the Mount Sinai School of Medicine in New York City. Your breast may get swelled with milk through a transitory process called engorgement and grow larger when you first start nursing, but once you've established a strong breastfeeding practice, they'll shrink in size. Your breasts will soften after you wean your kid, and unless you've gained or lost a large amount of weight, you may anticipate them to revert to their pre-pregnancy size. Myth: if you have small breasts, you won't produce enough milk to feed your baby. Size doesn't matter. The breast tissue you need to nurse a baby grows in response to pregnancy, regardless of your breast size, says Judith Lowers, IBCLC, a spokeswoman for the International Lactation Consultant Association. The milk ducts are found in the so-called functional tissue, rather than the fatty tissue that is responsible for breast growth. So whether you're an A cup or a D cup, rest assured that your breasts are capable of feeding your baby with the milk she requires. How about you? Which of these myths have you heard before and actually believed? Please tell us in the comments section below. Also, please watch out for part 2 of this video as I will discuss more of these breastfeeding myths. Thanks for watching.